this gentleman, because I know he's been building up his hand for a long time.
I was like getting here, we were talking about 5-HTP.
Yeah.
I'll just go over that a bit. What 5-HTP is more doing with serotonin, sleep function. Does it factor in other?
Yes, serotonin is hugely important for the body. It does affect sleep, yes, but it affects all sorts of other things as well. For example, the histamine release, which is an inflammatory release, again, is partially mediated by serotonin. So serotonin plays an enormously important role in the body. It's not confined to 5-HTP receptors.
Are these plants have any ill side effects on the heart?
When they're used by a professional, no.
That's fun stuff. Is there a study or correlation of head injury to
Correlational.
head injury that you suffer at maybe at a young age and
Is there any evidence for a correlation between
head injury that you
head
suffer,
injuries, trauma?
and a neurodegenerative disease like
There
developing
is for epilepsy and fibromyalgia, yes. There's not a lot of evidence in terms of MS, Alzheimer's or Parkinson's. But certainly it's been documented for both epilepsy and fibromyalgia, yes. Gentleman at the far back.
Would you recommend something to help somebody with throat cancer?
Oh, there's all sorts of things. I've currently got a patient with throat cancer. But there's not a simple solution, I'm sorry. If you'd like to make an appointment, happy to see you, but I can't answer that question here. But there is a lot one can do, yes. In fact, I have two when I think about it.
Name one.
Sorry?
You said there's two of them you can think about.
I have two patients
Oh,
with
I'm
throat
sorry.
cancer.
Oh, I thought you said two.
But there's a whole protocol. There's an awful lot you can do, yes. The lady in front of the gentleman.
Are multiple chemical sensitivities related to steroids?
There is some evidence beginning to show that that indeed is the case, yes. But yes, very much so. Lady in the front here.
I want to know if there is a relation between essential tremors and Parkinson.
Okay, you can get essential tremor in a person who does not have Parkinson's.
Okay.
And equally it exists in people who do have Parkinson's.
Okay.
Okay. It's to do with the dopaminergic neurons, which is why L-DOPA is given in Parkinson's and help to mediate that essential tremor.
Okay.
And popularly, Mancuna purana is sought after for that purpose.
Oh.
So it's not, but there are alternatives.
Okay.
I think somebody else. Yes.
One last question. Why is nutrition so important for good health?
Why is
nutrition so important for good health?
Why is nutrition so important
For good health.
For the very simple reason we are what we eat. If we don't eat the right foods, our body hasn't got the resources to deal with our function. Think of it as a car. If you don't give your car the right fuel, your car won't work. If you give it unleaded, when it takes diesel, it ain't going to work. So that's why you need food, to make our bodies work. Yes?
Sorry, to sum it up, what would you recommend to someone to take care of their gut aside?
I cannot recommend anything. I'm happy to have a consultation and discuss it with somebody, but there is no one thing. It's not an instant magic bullet. I'm very sorry. I know there's a lady over there.
Related to what she said about the gut, if it's been a long time, say 40, 50 years, is there a possibility of some reversal?
Yes.
Thank you.
On a lighter note, would there be any time a pill that will suffice for all our needs?
No, never. Sorry.
She's being facetious, I
They
think.
will never ever
Being
be a magic
facetious.
bullet.
On the
Right,
you
lady
know.
at the back on the right.
When you were talking about turmeric,
Yes.
I forgot what negative and what the good part of it is, and I don't remember.
Well, if you eat it as food,
What's
no,
not?
if you eat turmeric as food, you normally have it as a spice, a powdered spice. If you use it turmeric therapeutically, that depends how I treat, because it depends what's appropriate for the patient. Now, I think oh, yes. I think there was a lady on the left here. No? Fine, so we'll go back to the lady with the, yes.
Talk a little bit about the relationship between
Could I talk a little bit back?
the relationship between neurodegenerative diseases and neuromuscular?
Basically, neurodegenerative and muscular diseases are very closely intertwined. But in the diseases we've talked about, very often, particularly Alzheimer's and Parkinson's, there are direct correlations with dementia, but in the sense of progression too. But you don't necessarily get that in neuromuscular diseases. You don't normally get dementia with MS, for example. If you have, let me think of something. No, I'm getting tired, but there's a significant overlap, but there's not a total overlap.
Yes, 2 questions.
Yes.
This patient comes to you with Parkinson's or MS, and they're
Yes.
on traditional medicine, like cinnamon, etc. Do you usually wean them off the traditional medicine, or like?
Do I wean them off?
Yeah. I mean,
No, I use what is best for the patient. If they are on certain drugs that are beneficial to that patient and have been shown to give benefit, and there are no side effects leading to another condition, then I don't take them off.
side effects, are you saying most medicines have?
Yes, they do. Well, this is where we have to exercise our professional caution, because I may not have the answer to everything. Therefore, you do not take, professionally I cannot take anybody off their orthodox medicine by law. I can point out to them the pluses and the minuses, and it's their decision. There are some drugs it may be beneficial to continue with, and I use my medicine and work with that. In other words, I relate the two together. It's not a question necessarily of coming off. But where, for example, you may be having a drug that is doing no benefit to you and creating another condition, then I will point this out, I will give the evidence, and I will say, go and discuss it with your doctor. But would I do it? No. Yes, as the case may be, your decision, your choice. Now, a classic example of that is, recently I had a patient who's had a lot of neuromuscular issues, and I observed his very high statin use over a prolonged period of time. In my view, statin is a drug which is close, I think, should be close to being prohibited. However, leaving aside that, I pointed out this very high dose had created a situation called hypothyroidism, to the point now he was almost clinically in his blood work. Now, that in itself causes a whole number of other issues and problems. It was also the source of his neuromuscular problems and pains. So I wrote a letter to his family physician. I pointed out the blood work, which was evidence. I pointed out his high consumption for a period of time, and I then went and attached to my letter all the evidence about statins doing precisely what they had been shown to do in this person. And therefore I requested a review of the dosage of the statin. Well, to cut a slightly longer story short, the next visit his statin dose had been considerably reduced. And guess what? He wasn't having quite so much pain. No, if there is a case, and I think it's appropriate, I'm very happy to give the evidence. I never make a decision just because it's a conventional drug. And where it's appropriate, I work with the conventional drug. Very important. For example, somebody who came to me with epilepsy will be on that drug for life. I'm not going to anywhere stop recommending any way, shape or form that they discontinue. It would be totally unprofessional of me to do so. It's very important they maintain that drug. So,
Be a doctor's favorite.
Sorry.
sorry, can I take this young man? He's been very patiently listening to me.
Two questions here. What causes fibromyalgia and can it be reversed with plant medicine?
Right. The current theory about fibromyalgia is that it is an exotoxicity or a lack of glutamate in the brain. But some of the research that I showed you about from the microbiome is showing that bacteria have an influence in fibromyalgia. Now, many people who suffer from fibromyalgia very often are vegetarians. And it's been a professional observation that vegetarians tend to be deficient in key vitamins and minerals. And what is fibromyalgia but a disease where you're deficient in key minerals and vitamins? And in part of the endothelial reaction to inflammation. NO is a critical component. So by giving the body minute drops of NO, one could see an application for acute inflammation. I have seen no evidence that homeopathy works in chronic. Roughly, partly a reaction because there was a deliberate political policy of exterminating herbalists, which is now admitted, but that was what was going on then. So the naturopath was a movement to try and get around this problem. Now, they have become politically very strong and very capable. You cannot master, in my opinion, the 4 disciplines a naturopath is allegedly coming out of college equipped to use in 3.5 years. Each discipline requires 3 to 6 years. So that tells me immediately this person ain't sufficiently trained. Secondly, when it comes to herbal medicine, as far as I'm concerned, and it's a personal opinion, I don't think they have a clue. I would like to illustrate that by, it's not the fault of the students, they're simply not taught. I had a naturopath final year student ask me very nicely, could she come and observe how I treat patients and so on, because she was particularly interested in plants. So I said, well, I'm not sure what your training's been, and could you give me an example? So we agreed that she would write 2 monographs on 2 plants of her choosing. And then she'd submit them to me and I'd make a decision. And she did. And I was horrified because that showed me she was the equivalent of a year 1 to 2 herbal medicine student. What way in some communities may be acceptable to eat. But you don't know when you buy it from the supermarket where it's come from, and that's a big problem. Anybody else? Or can I go home?